Ever get that, like, nagging feeling that something's just off? You know?
Huh?
Like you're tired, maybe a bit achy, but nothing that really screams, go to the doctor. It's
Yeah.
like figuring out when those everyday aches and pains cross the line into, uh-oh, this could be serious, you
It
know?
really can be.
And let's face it,
Yeah.
most of us would rather just ignore those little twinges and hope they just kind of magically disappear.
Exactly.
But today,
Yeah.
we are tackling a topic
Uh-huh.
that's important to face head on. Potential signs of cancer.
It is.
And again, we're not
Yeah.
trying to turn anyone into a hypochondriac here.
Exactly.
But knowing what to watch for can be a real game changer when it comes to advocating for your
It
health.
really can.
We've got some excerpts from a great piece
Yeah.
on recognizing those subtle signs that might otherwise fly under the radar.
Exactly.
And one of the trickiest things about cancer
Yeah.
is that in its early stages,
Right.
it often whispers, not shouts. You know,
Yeah.
there might be no symptoms at all, or just tiny hints that are easily dismissed.
Exactly.
So regular checkups and screenings are key, right?
Absolutely.
It's like preventative maintenance for your body.
Yeah. It's like taking your car in for an oil change.
Exactly. You don't wait until the engine seizes up.
You got it.
So between those checkups, it's still vital to listen to your body.
Right.
And one of the first places to pay attention is your skin.
Absolutely.
I mean, most people know about sunburns and skin cancer.
Right.
But what about moles?
Sure.
I have a bunch of them, and they seem pretty harmless.
Well, most are.
Yeah.
But imagine you go to your annual checkup and your doctor points out that one of your moles has changed.
Okay.
It's gotten bigger. Maybe the edges have become irregular or the color is uneven.
Okay. That would definitely catch my attention. But how do you know if it's something to worry about?
Well, think of it this way. If a mole starts throwing a party,
Throwing a party.
meaning there are lots of changes happening all at once,
Oh, okay.
it's definitely time to get it checked out.
Yep.
Doctors use the ABCDE rule to assess moles.
What's that?
Asymmetry, border irregularity, color changes, diameter greater than 6 millimeters, and evolving or changing.
Okay, I'm going to have to remember that ABCDE rule. But skin changes aside,
Sure.
the article also talks about unexplained weight loss being a potential sign.
Right.
Now, isn't it normal to fluctuate a few pounds here and there?
Of course, we're not talking about dropping a pound or two after a weekend of healthy eating.
Right.
It's about a significant, unintentional drop. Say, losing more than 5% of your body weight within a few months.
Wow, that's a pretty noticeable difference. What could be going on there?
Well, cancer can disrupt the body's metabolism in several ways, sometimes leading to rapid weight loss. This is especially true with cancers of the pancreas, stomach, esophagus, or even the lungs.
Really?
Yeah.
I wouldn't have guessed that weight loss could be linked to lung cancer. Are there other subtle signs that people might not associate with something as serious as cancer?
Absolutely. Another one that's often overlooked is fatigue. Now, everyone gets tired sometimes,
Right.
but there's a difference between feeling sleepy after a long day and experiencing the kind of bone-deep exhaustion that cancer can cause.
Right, like that feeling when even the simplest tasks feel impossible.
Exactly. Imagine struggling to get out of bed even after a full night's sleep,
No.
or needing to rest after simple tasks like brushing your teeth. That kind of persistent, debilitating fatigue warrants attention.
So it's not just about being tired.
Yeah.
It's about feeling completely drained of energy.
Completely drained.
Yeah, what causes that kind of extreme fatigue?
Well, cancer cells can essentially hijack your body's resources,
Oh, wow.
leaving you feeling depleted. Plus, cancer can trigger inflammation and affect hormone levels, all of which can contribute to fatigue. It's often seen in cancers affecting the blood, like leukemia,
Yeah.
or organs like the liver.
So we've got skin changes, unexplained weight loss, and fatigue. What else should we have on our radar?
Pain is another big one. Now, I'm not talking about the occasional aches and pains we all experience. These are part of life. But persistent, unexplained pain,
Yeah.
especially if it's new or getting worse,
Okay.
is definitely worth a trip to the doctor.
It's like your body's alarm system going off. You shouldn't just hit the snooze button.
And what's fascinating is that the location of the pain can sometimes give clues about what might be going on.
Oh, really?
Imagine you've been experiencing nagging bone pain, for example.
Okay, bone pain. That sounds serious.
It could be a sign of something like leukemia or bone cancer.
Wow.
Or let's say you've been having persistent headaches or even changes in your vision.
I can see how that would be worrisome.
Those symptoms, while often due to more common causes,
Right.
could in rare cases be a sign of a brain tumor. And of course, persistent pain in the abdomen might signal a problem with organs like the liver or pancreas.
So paying attention to the location and nature of the pain is key. You know, it's interesting how some of these potential cancer signs are things people might just brush off as everyday annoyances.
It's true. And another one that falls into that category is changes in appetite or taste.
Oh, interesting.
Have you ever had food taste off for no apparent reason
Yeah?
or noticed a strange metallic taste in your mouth?
Now that you mention it, I have had that happen a few times.
Yeah.
I just figured I was extra tired or something.
It could be nothing, but sometimes
Yeah.
changes in taste and appetite can signal problems with the digestive system,
Okay.
including cancers of the stomach, pancreas, or liver.
So even something as simple as food tasting different could be a sign to pay attention to.
Exactly. It's all about looking for patterns and paying attention to those subtle shifts that might be easy to dismiss on their own.
Speaking of subtle shifts, what about coughing? We all get coughs from time to time, but when does it become a concern?
Well, picture this. You've had a cough for weeks,
Okay.
maybe even months,
Yeah.
and it just won't quit. Maybe your voice is hoarse, or you're even coughing up blood.
Okay, coughing up blood, that definitely sounds like a trip to the doctor is in order.
Absolutely, especially if that cough is accompanied by shortness of breath.
Oh,
Even when you're not exerting yourself, those could be signs of lung cancer, even in people who have never smoked.
So even if you don't fit the typical smoker profile,
Right.
those kinds of respiratory symptoms are worth getting checked out.
Without a doubt. And while we're on the topic of things people might not want to talk about,
Okay.
we need to mention changes in bowel and bladder habits.
All right, time to get a little personal. But I know you're right. These are things we shouldn't ignore.
Yeah. Think about those everyday bathroom trips.
Yeah.
Are you suddenly experiencing persistent diarrhea or constipation? Has the shape of your stool changed? Are you noticing blood?
Those are definitely not things you want to chat about over dinner. But they could be important signals, right?
They could be. Changes in bowel habits like that could be a sign of colorectal cancer.
Oh, what?
And on the bladder front, pay attention to things like frequent urination, pain during urination,
Yeah.
or blood in your urine.
So if those bathroom trips are becoming more frequent, uncomfortable, or just plain weird,
Right.
it's not something to just brush off.
Exactly. And look, I know these are sensitive topics,
Right?
but it's crucial to get checked out if you're experiencing persistent problems.
Okay.
Don't let embarrassment get in the way of your health.
I love that. No shame in talking about poop and pee when it comes to your health.
Exactly.
So we've covered skin changes, weight loss, fatigue, pain, taste and appetite changes, coughs, and even bathroom habits. Is there anything else we should add to our mental checklist?
We're not done yet. We still need to talk about unusual bleeding,
Okay.
lumps and swelling.
Uh-huh.
And one more symptom that's often overlooked but can be very important.
Okay.
But we'll save those for part 2 of our deep dive.
I'm already feeling more informed.
Good.
And a little more in tune with my body. Can't wait to hear more.
We'll be back soon to finish unpacking this important topic and empower you to take charge of your health.
Welcome back. I don't know about you, but after part 1, I've been way more aware of all my body's little signals.
That's great. That's exactly what we hope for.
Okay.
Awareness is like the first step.
Right.
And we left off talking about some pretty sensitive stuff, but trust me, the conversation is not over yet.
Okay, I'm ready for more.
Okay.
You mentioned unusual bleeding being something to watch for. What exactly does that mean?
Well, think of it this way. Your body has a system, right?
Yeah.
Blood usually stays inside, unless there's a cut or something. So
Right.
anytime you're bleeding from a place that doesn't make sense,
Yeah.
that's your body trying to tell you something's wrong.
So we're not talking about a paper cut here.
No, definitely not.
Yeah.
We're talking blood in your stool, urine, when you cough,
Okay.
or for women, unexpected vaginal bleeding.
Yeah.
These can be signs of various cancers. Blood in the cough could indicate lung cancer, while unexpected vaginal bleeding might be linked to cervical or uterine cancer.
Got it. I'm starting to see a pattern here.
Mm-hmm.
Anything out of the ordinary,
Yeah,
especially when it comes to bleeding, is worth getting checked out.
exactly. Now, another one that tends to freak people out is finding a lump or swelling.
Oh, yeah.
We've all been there.
Oh, tell me about it.
You're like feeling around and suddenly there it is.
Yeah, and then you start to panic.
Panic sets in. So how do we know when a lump is harmless and when it's something to worry about?
That's a good question.
Here's the thing. Not all lumps are created equal.
Okay.
The location size,
Oh,
how it
nothing.
feels, all of these things matter.
Yeah.
Imagine feeling a lump in your breast, for example.
That'd be scary.
It's understandable to be concerned.
Yeah.
Breast cancer is one of the most common cancers in women, so any new lump in the breast should be checked by a doctor.
Oh, okay.
But lumps can appear elsewhere too, and they're not always cancerous.
Like what?
Well, you know how when you're sick, sometimes the lymph nodes in your neck get swollen?
Yeah, I've definitely felt those.
Lymph nodes are part of your immune system, and they can swell up in response to all sorts of things, from a simple cold to a more serious infection. But in some cases, swollen lymph nodes, especially if they're hard, painless, and don't go away, could be a sign of lymphoma,
Oh, wow.
a type of cancer that affects the lymphatic system.
So location and other symptoms are really important clues.
Exactly. And don't forget about abdominal swelling.
Okay.
Persistent bloating that doesn't go away could be a sign of ovarian cancer or a gastrointestinal cancer. The key takeaway is this. If you find a lump,
Yeah.
don't panic,
Okay.
but don't ignore it either. Get it checked by a doctor.
Got it. So we've covered unusual bleeding and lumps.
Yeah.
What was that last symptom you mentioned?
This one often gets overlooked, but it can be a crucial signal. Shortness of breath.
Okay.
Now, we all get winded from time to time, especially if we're out of shape or just climbed a flight of stairs.
Oh, tell me about it. Stairs are my nemesis.
But how do you know when it's more than just being out of shape?
Yeah.
How can you tell?
Imagine this. You're doing everyday activities,
Yeah.
things you used to handle with ease.
Mm-hmm.
And suddenly you're gasping for air. Maybe you can't walk across the room without feeling winded. Or you wake up in the middle of the night feeling like you can't breathe.
That sounds terrifying.
It can be. Shortness of breath can be caused by lots of things. But one possibility is lung cancer,
Okay.
or cancer that has spread to the lungs. If those cancer cells start to interfere with your breathing, it can cause that feeling of breathlessness,
Yeah.
even when you're not exerting yourself.
So if I'm suddenly struggling to catch my breath, even when I'm just sitting around, that's a red flag.
Yes. And it's especially concerning if it's accompanied by other symptoms, like a persistent cough, wheezing, or coughing up blood.
Oh, wow.
Those are all signs that something might be affecting your lungs.
Okay. This is a lot to take in. We've covered so many potential signs,
Yeah.
from those subtle changes to the more dramatic ones.
It can feel overwhelming.
Yeah.
But remember, knowledge is power.
Right.
By understanding these signs,
Yeah.
you're empowering yourself to take control of your health. Absolutely.
Hmm.
But I have to ask, knowing all this, doesn't it make you worry more?
It's natural to feel a bit anxious,
Yeah.
but I think of it more as being informed.
Okay.
I pay attention to my body, get regular checkups, and if something feels off, I don't hesitate to talk to my doctor.
That's a good point. It's not about living in fear.
Right.
It's about being proactive.
Exactly. And speaking of being proactive,
Yes.
there's another layer to this conversation that we need to address. Risk factors.
Okay.
These are things that can increase your likelihood of developing cancer.
I know we touched on a few already,
Yeah.
like family history,
Right.
but what are some other risk factors we should be aware of?
Let's start with something we all know is bad for us. Smoking.
Okay.
I'm talking cigarettes, cigars, pipes, anything that involves inhaling tobacco smoke.
I think everyone knows smoking causes lung cancer, but are there other risks?
It's not just about lung cancer.
Oh, really?
Smoking significantly increases the risk of cancers of the mouth, throat, esophagus, bladder, pancreas, and more. Those 7,000 plus chemicals in cigarette smoke. Many of them are known carcinogens, meaning they can damage your DNA and lead to cancer.
So quitting smoking, or better yet, never starting,
Right.
is one of the most impactful things you can do for your health.
It's a game changer for sure. And while we're talking about lifestyle choices,
Yeah.
let's not forget about alcohol.
I enjoy a glass of wine now and then. Is that a problem?
Moderate drinking is probably fine for most people, but excessive alcohol consumption,
Okay.
think heavy drinking or binge drinking,
Yeah.
is linked to an increased risk of several types of cancer, including liver, breast, and colorectal cancer.
So moderation is key,
Mm.
as with most things in life, right?
Exactly.
Yeah.
And speaking of moderation,
Okay.
let's talk about diet and exercise.
All right. Hit me with those healthy living tips.
We're not reinventing the wheel here.
Mm.
A diet rich in fruits, vegetables, and whole grains has been consistently linked to a lower risk of many types of cancer.
Okay, so load up on the good stuff and ditch the processed junk.
You got it. Those plant-based foods are packed with antioxidants, vitamins, and fiber, all of which can help protect your cells from damage. And don't underestimate the power of exercise. Regular physical activity.
Okay.
Think brisk walking, jogging, swimming, anything that gets your heart rate up
Yeah.
has been shown to lower the risk of several cancers, including breast, colon, and endometrial cancer.
So healthy diet, regular exercise, those are the cornerstones of a cancer prevention strategy.
They're a great foundation. But there are other risk factors to be mindful of, too.
Like what?
Well, one of the biggest culprits is UV radiation from the sun.
Okay.
We all love a sunny day. But prolonged exposure without protection can significantly increase your risk of skin cancer.
Right. Sunscreen, hats, all that good stuff.
Exactly. And then there are certain chemicals and substances that have been linked to cancer, things like asbestos radon and certain pesticides.
So being aware of your surroundings and taking steps to minimize exposure is important too.
Absolutely. Now, there's one more risk factor that we can't do anything about. Age. As we get older,
Yeah.
the risk of most cancers goes up.
Why is that?
It's basically a matter of wear and tear.
Okay.
Over time, our cells accumulate damage.
Yeah.
The longer we live,
Yeah.
the greater the chance that something will go wrong and lead to cancer.
That makes sense.
Hmm.
So as we age, it becomes even more important to pay attention to those potential warning signs and get regular checkups.
Couldn't agree more. And here's the good news. Even if you have some of these risk factors, it doesn't mean you're destined to get cancer.
Yeah.
Lots of people with risk factors never develop the disease.
Right.
And there are things you can do to lower your risk, like making those healthy lifestyle choices we talked about.
So there's always hope, and there are always steps we can take to protect our health.
Absolutely. But we're not quite done yet. There's one more crucial piece of the puzzle that we need to discuss. Screenings.
Okay.
And we'll dive into that in part 3.
Can't wait to hear more. See you soon for the final part of our deep dive. Okay, we're back for the final part of our deep dive into potential cancer signs. And I have to say, this has been like a real eye-opener.
Yeah, I hope so.
Yeah, it's been a lot of information,
It is.
but in a good way
Right.
in this last part.
Yeah.
We want to shift gears a bit
Okay.
and talk about taking action.
Right. Because knowing the signs is one thing,
Right.
but knowing what to do with that knowledge,
Exactly.
that's what really matters.
Yeah.
So let's talk about screenings.
Okay.
These are tests that can help detect cancer early, even before symptoms appear,
Okay.
which can be a real game changer when it comes to successful treatment.
So things like mammograms for breast cancer and colonoscopies for colorectal cancer.
Those are great examples, and there are different screening recommendations for different types of cancer.
Okay.
Your doctor can help you figure out which screenings are right for you based on your age, risk factors, and family history.
So it's not one size fits all.
Not at all. Screenings are tailored to individual needs. It's like getting a custom-made suit.
Okay.
It's got to fit
Yeah.
you perfectly.
I like that analogy.
Yeah.
So let's say you've been experiencing some of the symptoms we've talked about, and you're worried about cancer.
Right.
What's the best way to approach that conversation with your doctor?
First and foremost, don't be shy.
Okay.
Your doctor needs to know what's going on.
Right.
So speak up.
Yeah. It's easy to feel like embarrassed
Exactly.
or scared to talk about these things,
Right.
but advocating for yourself is so important.
It really is. And when you talk to your doctor, be as specific as possible about your symptoms.
Okay.
Tell them when they started, how often they occur, what makes them better or worse,
Yeah.
and any other details you can think of.
So paint a clear picture for them.
Exactly. Think of it like you're giving them a map
Okay.
to help them navigate your health concerns.
Makes sense. And what about those awkward topics?
Right.
Like bowel and bladder changes?
Yeah,
Those can be tough to bring up.
I get it.
Right.
But trust me, your doctor has heard it all before,
Right.
and they need to know about these things to make an accurate diagnosis.
Oh,
Remember, nothing is TMI when it comes to your health.
okay. Good to know. So let's say your doctor suspects cancer. What happens next?
They'll likely order some tests to confirm the diagnosis.
So things like blood tests,
Right.
scans,
Yeah.
and maybe even a biopsy?
You got it. A biopsy is where they take a small sample of tissue
Sure.
to examine under a microscope. It's often the most definitive way to diagnose cancer.
I imagine that waiting for test results can be
Oh.
nerve-wracking.
It definitely can be. It's like waiting for the verdict in a trial. My advice.
Okay.
Lean on your support system during this time.
Yeah.
Talk to friends and family.
Mm-hmm.
Find a therapist. Do whatever you need to do to cope with the uncertainty.
That's such important advice. Having people to talk to can make all the difference.
It really can.
Yeah.
Now, let's say the diagnosis is confirmed.
Okay.
You do have cancer. What happens then?
That's the big question, right?
It is. And the next steps will depend on several factors,
Right.
including the type and stage of the cancer, your overall health, and
Oh.
your personal preferences. It's a very individualized approach.
So like a fingerprint.
Yeah.
Every treatment plan is unique.
Exactly. Your doctor will work with you to create a plan that's right for you.
Yeah.
This could involve surgery,
Mm-hmm.
radiation therapy,
Oh.
chemotherapy,
Yeah.
immunotherapy,
Mm-hmm.
or a combination of these approaches.
Wow. There are a lot of options out there.
There are, and thankfully,
Yeah.
cancer treatment is constantly evolving and improving. It's important to remember that there is hope,
Right.
even in the face of a cancer diagnosis.
That's a powerful message.
Mm.
So throughout this entire deep dive, we've covered signs,
Yes.
symptoms,
Yeah.
risk factors, screenings,
Mm-hmm.
and even what to expect if you're diagnosed with cancer. What's the most important thing you want our listeners to take away from this?
If I had to boil it all down to one key message, it would be this. Be proactive about your health. Pay attention to your body. Get those regular checkups. And don't be afraid to talk to your doctor if something feels off.
Right.
Early detection can truly save lives.
Couldn't have said it better myself. Be informed,
Yes.
be proactive,
Mm-hmm.
and be your own health advocate.
And remember, you're not alone. There are incredible resources and support systems out there to help you through every step of this journey.
Well said. We hope this deep dive has empowered you to take charge of your health and well-being. That's a wrap on this episode of The Deep Dive. Thanks for joining us.